So we stopped at mindfulness. Like I harped on it a lot because I think it's important to find a way to convince you all how important it is and how helpful it can be. And actually, I can go back to a video now that I learned that I have more time. Oh wait, no, I can't go back to a video. I take that back. I forgot we don't have the speakers. So really and truly, mindfulness it's simple. It's like peer support. It's simple. And at lunch, one of the kind police officers, we had a good conversation about SISM versus peer support and why is SISM bad. And I never said SISM's bad. SISM's not bad. It has its place. Some people are great at peer support. Some people are great at SISM. And some people are great at both. But you have a lot of people who might not be so good at SISM who would make amazing peer supporters because of their life experiences. And you have a lot of people who would be magnificent SISM members who might not be so good at peer support. Because peer support is all about vulnerability, all about shared difficult experiences. SISM sticks a lot to the trauma. And one of the key takeaways from our conversation on it was, she mentioned that with SISM, everything's confidential, but sometimes it can be forced to be shared. It can be subpoenaed or whatnot. With peer support, it doesn't. Peer support, it is always confidential unless immediate danger or mandated reporter situation. And then again, with peer support, especially the way we built our team in North Carolina, and the way I hope that Virginia will build their team, or their goal, is it's outside the agency and its own standalone nonprofit. Our group for the peer support team is all personal email addresses. We don't use work email addresses, so nothing goes through the work database. Nothing can be read. And then also, we use a GroupMe chat group to message people and to reach out to people. And it's all personal phone numbers on there, and it's all in that GroupMe thing. So that's where peer support can be a little benefit or just a little different from SISM because it's not a mandated service, it's not through the chain of command, and it can be outside the department. Does that make sense? So remember, have you guys heard the talk now? People are saying, shouldn't we be screening people before they get on the job to see who's susceptible for PTSD and who's susceptible for depression and whatnot? Have you guys heard that? And there's a lot of talk to do that, and it's like that might be a good idea. Any of y'all thinking that might be a good idea?
Good luck.
Good luck. I love that response. Because no, it's a terrible idea. It's to me, and this is my opinion, it's a terrible idea. I don't care what type of trauma you've experienced. I don't care about your early lifehood experience, your early lifehood adversity. I don't care if you've seen or done a few crazy things in your life. What matters is, do you have the skills to cope? Yeah? That's what matters. It doesn't matter about your experiences. It doesn't matter what you've seen. It doesn't matter how I label you. Can you cope? And Kevin Hines, again, his story, one of the most powerful things about him and his story is he's bipolar. He knows he's bipolar. And if you're bipolar, you have a really high chance of attempting suicide. And you have a much higher chance of dying by suicide than most people. He knows what's wrong with him. He knows his diagnosis. And now, because of that, he knows how to cope. He recognizes his thoughts and he knows how, what to do when they come. He knows that he's got to exercise. He knows that he has to see his clinician. He knows he has to take certain medications. It's all about coping skills. And that's where we really are lacking in public safety, because we're not equipping our people with proper coping skills. We're kind of letting that one slide. We're saying, hey, it's a good idea to exercise. It's a good idea to have friends and sleep. So just think about that. But we're not teaching them and we're not giving them the tools to actually do those things. So again, I harp on the mindfulness-based resilience training. Looking into that, trying to institute that in your academies will make a difference. And it's so easy. It's simply being kind to your mind. And it's just focusing on the here and now. That's it. It's a very simple practice. The Navy SEALs, I talked about their breathing technique, and how it works is through breathing slowly and deeply. It activates the hypothalamus, which blocks adrenaline, releases cortisone, and tells the body to decrease blood pressure and pulse. So through their 4x4 breathing, they're able to get their prefrontal cortex to stay online. And they're able to control their emotions, and they're able to control their thoughts and their way through things. So we can train our brains to do that. So this is something at the individual level that we can do to protect our people and protect ourselves. And it starts with us. If you can create a crisis card and believe in it, and then you can share that with somebody, share that with your crew, share that with the people around you, you give somebody an option. Because again, going back to the brain, when we're under stress and the amygdala receives a stressful fight or flight response, our prefrontal cortex goes offline. Our ability to think goes offline. And that becomes tunnel vision. You get stuck in that tunnel vision. So that's why when you're depressed, when you're stressed, and all of a sudden the thought of suicide comes to mind, or the thought of something bad comes to mind, it's all you can think. You can't see outside of that. It's because this has gone off. It's hard to think through it. But again, the limbic system is our habits and our instincts. So sometimes it's about creating those habits and instincts. And a crisis card and forcing yourself to pull that out and to have that and to know that it works can help save you. So on the crisis card, it's simple. You write the names of 3 people that you can call anytime. Remember when we were talking about connection and the thought of nobody cares? And we know that that's not true. Anytime anybody dies by suicide, they found that there were 6 people who were strongly damaged by that, because those 6 people cared so strongly, and over 100 people who were actually impacted. There's always people that care. So before you're in that crisis, before you're overwhelmed, think of 3 people that you can call. Talk to those people. Let them know, hey, I'm creating this crisis card. I learned about it in this weird mental health symposium that this weird girl talked at. She told me to do this. Do you mind if I put you down? And I want you to know that if I ever need somebody and I'm in crisis, you'll be somebody I call. You let them know ahead of time. So write those 3 names. Think of 3 things that you do that you enjoy. Y'all saw my bike outside. I like to mountain bike. Whenever I mountain bike, I feel good no matter how much stress I have. You know, yesterday I got done teaching. I drove 3 hours and I hate driving. And the first thing I did was go straight to the trail. And it was like, it hit the reset button. So I know that works for me. So think about what works for you. For some people, it's gardening. For some people, it's talking on the phone, playing Sudoku. I don't know. Everybody has something different that they do that makes them feel good. So just think about what works for you. Write it down. And then finally, a known stress reduction activity, a mood regulating activity. What is that? How is that different from bike riding? It's like mindfulness. It's something like that. It's actually a skill that you learn. So it's incumbent on us to learn those. Anybody here yoga? Oh, awesome. Yoga, man, is great, but I know that that's I'm not going to be able to talk you guys into picking up on it, so I'm not going to try. I can at least maybe talk you into mindfulness. I can talk you into the Navy 4-square breathing, because that's easy. It's easy. You can do it. It doesn't take a lot of work, and it works. So write those 3 things down. Keep that crisis card, and help other people make crisis cards, because we never know who's suffering, and we never know who needs one. Another phone number to put on it, 1-800-273-TALK. If you don't have that phone number stored in your phone, store it now. 1-800-273-TALK. That's the Suicide Prevention Lifeline. Their job is not to ping and pinpoint your location. Remember we talked about the ambivalence that people feel who are suicidal? They're on that teeter-totter. The Suicide Prevention Lifeline, their goal is to push the people towards life. Give them hope. Give them purpose, and give them a reason to stay alive. So everybody should have that phone number in your phone. And again, everybody should make sure that the people that work close to them have that phone number in their phone. And we advocate for those things. So the last piece before I turn it over to EAP, and it's kind of getting us to EAP, is the value of the bridge to care. And I'm going to talk just a little bit about treatment considerations. I hope I don't step on anybody's toes. But what I found after I did the 2-day peer support class, all of the ones I took, where we never talked about what those treatments were. We never talked about the different levels of care or what treatment was. So it was still very fuzzy. So that's kind of what that bridge looks like. It's not as clear as the first one I showed. It's really cloudy. You don't know what's on the other side. So I just want to go through this really quickly and just give you guys a little idea. So when to refer, I think the biggest takeaway is it's not always going to be black and white. And like I said earlier, we could all benefit from seeing a therapist 2 or 3 times a year. It'll make us all feel good. So always lean on the side of refer if you're worried. Always lean on that side. But you know, certain behavioral health disorders that clinicians can help. Substance abuse, anxiety, depression, panic attacks, sleep disorders, Those are some things that it's more than just talking. There are things that can be done to fix these issues. For example, did you know that panic attacks, they're not just a fake, made-up, crazy person thing? A panic attack is often that stressor being stuck in the limbic system and never being processed. So through talk therapy, EMDR, cognitive behavioral therapy, through those therapies, the events are processed and panic attacks can go away. So a lot of times people who have panic attacks, they're not faking it. They actually have some sort of stressor that hasn't been resolved that needs to be resolved. So I know you can't see this well. And again, if anybody wants a copy of this presentation, just email me and I'll send it to you. But I found this on the Florida Firefighter Safety and Health Collaborative. It's a mental health continuum. And basically, it's a little guide to help with that not so, black and white gray area. On the green side, normal functioning. Yellow, it's reacting to stress. So you have impatience, nervousness, sadness, forgetfulness, things like that. But it's all temporary. And then when people need professional care, because the green and the yellow, that's a lot of peer support and self-care. The orange and the red, that's when somebody needs professional care. And that's when it becomes anger, it becomes performance issues, preoccupation, significantly disturbed sleep, avoidance of certain situations and people and whatnot. And then ill is when there's significant difficulty in emotions and getting through the day, depressed mood, and it's lasting for a long period of time. So that continuum just kind of helps to know when peer support's enough and when it's not enough. So very quickly, I'm just going to talk about the different types of mental health professionals, because when I finally figured it out, it was so enlightening for me. So we look at this, and it's almost like the top, the psychiatrist, that's the most training. The way I looked at it was they're the best. I always want to go to them. And then you look down and you see the clinical social worker and you're like, oh, they're the bottom. I don't want to use them. I want the psychiatrist. Well, the first person that we associated with our team was a psychiatrist. And he came to us and told us about his experience after 9/11 and how many first responders he helped and all this stuff. And I was like, yes, we got gold. I was so happy to get him on the team. The first guy that I referred to him who was depressed, going through relationship problems, marriage was falling apart, wasn't functioning well, I referred to him and he called me back and he said, screw that guy. He made a 15-minute appointment and wrote me a prescription and didn't help me at all. So I quickly realized through talking to people that psychiatrists are not always the best option. They're medical doctors and they focus a lot more on medication. Their schedule windows are very short, and they should be working in tandem with other clinicians to get people right. So in fact, we shouldn't be looking at it from the top down. We should actually be looking from the bottom up. When you start with a clinical social worker, they get you to the right person for what you need. They know what you need, and they will take time to get you there because their windows are a lot bigger. They're willing to work with people because that's their goal. They actually care about us. I mean, everybody cares about us, but they're made to care more about us. I made this little drawing, again, back to the threes because I love threes. When we talked about hope and perseverance, this drawing helps me to understand that clinical experiences aren't always going to be perfect. These are, on the left is what you're going to run into, from unhelpful to the best of the best. And it takes persistence. It takes getting the right person for you. And how do you find the right person for you? That's what's on the right. They have to be culturally competent, meaning they have to be willing to drive an hour and a half to come hear us talk and learn about us. They have to be a great clinician. Quick question. Anybody know any police officers or firefighters who you do not want going to your house?
Yeah. Yep.
It's like that in every profession. It's like that in every profession. So you're going to have clinicians that you don't want with your family. Doesn't mean they're all bad. You're going to have clinicians that are amazing. Sadly, it doesn't mean they're all amazing, just like first responders. We've got some that, man, I would love to have on my crew and I want coming to my house, and then we have some that I'm like, oh my gosh. And then finally, easy connect with. Look around the room, we're all different. We all connect with people differently with our different experiences. So the clinician that I connect with, that I communicate well with, that I feel comfortable with, might not be the clinician that Brandon feels comfortable with. So that's what you need to find the best of the best, the 1%. It's got to be somebody that you're easy to connect with, a great clinician, and they've got to be culturally competent. And that's where the persistence comes in. That's where you might have to call and make an appointment with 3. to figure out which one's going to work for you. Most of them, when you call them, they get it. They understand that you're kind of vetting them. So you let them know, hey, I'm looking for a clinician. Do you mind if we just make an appointment so that we can meet, get to know each other, and see if you're who I want? If I step on your toes on any of this, just hush me up. So psychiatrist versus psychologist, like I said, the psychiatrist is an MD. They've gone through medical school like every other doctor, and then they did their specialty in psychiatry. So they are a medical doctor. They focus on the brain and giving prescriptions. Whereas a psychologist, they got their PhD or their PhD. One did it through research. One did it through a lot of clinical time. They really should be working in tandem to help people. Because remember what we talked about, the hot coals? If you're standing on hot coals and taking pain pills, the pain might be going away, but the underlying problem isn't. So that's where them working in tandem can help get the underlying problem. A therapist is a broad umbrella term for a trained professional. There are many different types of therapists, and they all have different modalities. Therapists are great, but just remember, not all therapies work for all people. We're hearing EMDR right now. It's the big buzz therapy. Everybody's saying it's the best thing there ever was, and everybody should get it. It doesn't work for everybody. No therapy does. And a good therapist, a good clinician will tell you that. They will tell you that we need to figure out what's going to work for you. Certain traumas aren't great for EMDR, whereas others are. It's things like that. The licensed professional counselor, therapists can do extra hours to get that licensing, yeah, God. Yes, you guys got it. And I've heard people recommend, they're like, hey, make sure you get somebody who's got more experience and gets this and that. But I've met firefighters and police officers with a month of experience that were the best ever. So, that's just my thought on that. And do I describe the social worker well here? And that's really the social worker. They are experienced in counseling, psychology, and sociology. They can kind of help with, do you need therapy? Or do you need some mediation, family mediation? Do you need help with the finances? Do you need help with a lawyer? They help you get the right help that will get you what you need. They're fantastic. This one's closer. I spent a little time talking about social workers just because I knew that I stigmatized them and didn't understand them so well until now. But social workers are incredible. What they really do is this person right here, just covered in information. They're on top of a lot of the information out there, a lot of the research, a lot of the therapies, a lot of the options for us. So social workers are magnificent and can be so helpful. Levels of care, there's so many different levels of care. I won't spend too much time on this because y'all are probably super tired of me. But it starts from the self-help and it goes all the way to residential and inpatient treatment, which you'll hear from today. And then now I'm going to close it out by just hitting on a couple of evidence-based therapies. Because I never realized that therapy was more than just talking. I never realized that the brain had issues that needed to be fixed, and it took therapy to fix. So these evidence-based therapies that are up here now, these are all the ones that have been found to work great with military and first responders. These are the ones that we need. But again, remember, there's no one size fits all. You have to find what works for you based on your life experience, and we're all different. So mindfulness-based cognitive therapy, it's basically taking cognitive behavioral therapy, which is understanding your thoughts, your feelings, and how they affect your behaviors, and imparting that mindfulness that we talked about. It's a neat therapy that can help you to break the depression cycle. We were talking at lunch about the depression cycle. If you've ever gotten to the point where you've gotten seriously depressed, it took a long time to get there. And once you got to feeling better, a trigger can bring you right back there just like that. You get into that negative cycle, and this kind of therapy will keep you out of that cycle or will prevent you from getting there. Dialectical behavioral therapy, it is a spin-off from cognitive behavioral therapy, but with dialectical behavioral therapy, this one helps you to not judge yourself for having feelings the way that you do. Cognitive behavioral therapy addresses that you shouldn't react to these feelings, whereas dialectical behavioral therapy tells you that your reaction isn't bad, but here's a better way. The clinician who created it is a really fascinating story. She was actually diagnosed as with antisocial personality disorder, and there's nothing for her, nothing to treat her, so she created this therapy, and now she's like a leading educator and researcher, and it's just a beautiful thing. It's fantastic. But this one therapy has been found to be very helpful with people who are suicidal. It can actually save their life. Seeking safety, trauma focused. Do you know if they do that at the Center of Excellence? If that's one of the therapies?
I'm sorry, can you repeat yourself? I apologize, I wasn't.
No, it's okay. Do you know if seeking safety, if this is a therapy done at?
We haven't, no.
Okay. This is one that is done it has to be done in an inpatient setting because it takes 25 treatments to kind of get the results. But this one's a great one for people who are suffering from PTSD and are addicted to substances. It really helps to separate those addictions and get through them. And then I talked briefly about cognitive behavioral therapy. Most of these are delivered over a 12-week period. So you're not going to talk to somebody one time and feel better. It takes that persistence. That's where persistence and knowing that, it takes at least 12 visits to get to feeling better. But this one really helps to develop those useful coping skills and recognizing when your emotions are making you do things you shouldn't do. Prolonged exposure therapy, that's one of the first treatments for first responders. It came straight from the veterans, and it sounds like it would be an awful idea. It is basically talking about the trauma and working all the way through it over and over and over again. It sounds like that'd be the worst thing ever, but it's not. It helps you to understand the trauma, and it helps you to store it and not react to it. This is a new one. It's called accelerated resolution therapy. It's similar to EMDR, but one of the reasons it was created and one of the reasons it's becoming popular is because whereas EMDR takes 8 to 12 visits, this one can see results in 2. It can see results a lot quicker. And unfortunately for us as first responders, we're not willing to pay money for 12 visits, and we're not patient. So this is being studied and tested. Military, I know the reason I found out about it is because in my state in Fayetteville, they're doing a lot of work with it, and they're seeing good results. 2% of people have a negative response to it, but for the most part, they're getting pretty good responses. And then also, this is one of the only ones that people do not have homework. Most of the other therapies, you go home and you have homework. And they're finding that, unfortunately, we aren't willing to do the homework. We show up for the therapy, and then we leave, and we don't do what the therapist asks us to do. And then eye movement desensitization and reprocessing. EMDR, I've heard nothing but good things about it. It's fantastic. But again, I just want to say, I don't want to do like I hear a lot of people doing, saying this is the be-all, end-all, because no matter what, not everything works for everybody. So this one might work for 9 of your peers and not 1. That's why it's important to understand that and know that there's other options out there and not to be stuck on the end-all, be-all. This is, it's 8 to 12 sessions that last 90 minutes, and really what EMDR does is it takes the emotional brain and the rational brain, and it forces them to communicate and process a trauma. Because when traumas get stuck in the emotional brain, that's what makes you have those anxiety, those crazy reactions. But when it communicates with the prefrontal cortex, those reactions don't happen, and then it stores as just a memory without a response. So that's how it works. And then finally, last one, experiential treatments. These are what we like as first responders, specifically equine therapy. And I wish I remembered the name of it, but there's an equine therapy group that we met yesterday. I think it's CAPS. Have any of you guys heard of them?
There's New Freedom Farms here also.
This one's free. Out of Richmond, it's somewhere. A guy named Andy runs it, but it's free. And he came and talked to us yesterday. I'll make sure to get that and give it to you. But the fact that it's free is what's amazing. Anytime. I'll text them real quick.
Free to all veterans and first responders.
Yeah.
I think that was it.
Yeah, New Freedom Farms.
Where is it?
Buckhannon, yeah.
Yeah. So equine therapy has been found to, and this is an interesting thing I didn't mention, of all these therapies, nobody really knows how they work. That's what I thought was amazing when learning about them. Nobody really knows how they work, none of them. But they just know that they work through the studies. And the same thing with these experiential treatments. They don't understand exactly how they work, but they understand that when your body and your mind work together, it helps to calm you and process. Because the goal of all of these, the goal of everything, is to process events. That's why getting good sleep is so important. That's why talking is so important, because that's how you process. That's what all these do, is they help you process. And they found with the equine therapy, animals mirror humans, and humans mirror animals. And the animals, you have to show them that you're safe and that you trust them, that you'll open up to them, and they do the same. And then all of a sudden, it just becomes such a relaxing, awesome experience. Art therapy has been so beneficial. This is a neat one. I was at a treatment facility where they just had the first responders kind of draw their masks. And it was interesting to see how everybody's mask on the outside was the same thing. It was like Superman. But then on the inside, everybody's was the same thing. It was like cowardly under it. We all put on this Superman on the outside, but a lot of us on the inside don't feel like we can live up to it because we're not Superman and we don't have to live up to it. And then finally, yoga again. I know. I'll save that for somebody else another day. So again, none of this is mine. It's all cited. It's all based on empirical evidence, research. So if you want any of this information, just email me, and I'll be happy to send it to you. Thank you for having me. Sorry that it was a lot of information, and I went over. Awesome. Woo. Thank you.